I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. Our guest today is Mary Kay Rizzolo with CQL. Welcome, Mary.
Thank you.
Mary Kay.
Yes.
What is CQL?
CQL stands for the Council on Quality and Leadership, and we are an international accreditation body, but we do a lot more besides accreditation. We also do training and certification, consultation, and research.
So, accreditation, what does that mean?
So we are an external body that goes into a provider or a state system, and we help them look at their systems and their practices to make sure that they're delivering quality services and that people are having good quality of life.
Okay, are there particular fields that you work in with this?
We do a lot in the developmental disability field, but we also work with aging populations and people with psychiatric diagnoses. Those are the main ones.
Okay. And what types of organizations do you usually work with?
We work with providers who provide long-term services and supports.
Okay.
So things like residential habilitation or supported employment, different vocational opportunities, case management, things of that nature.
All right. So, Mary Kay, how did you come to this role? What's your background?
So I actually began in the field back in, let's say my first experience was in 1991, where I worked in a special education classroom as part of a college course. And so after that, when I was working on my master's, I worked at a state institution in North Carolina, and I also volunteered at a community provider. And so I was able to see the difference in the models, and I realized, I wanted to do more to help promote the community model and to get people out of the state institutions and more segregated settings.
Yeah, so we have that in common. I worked at a large state institution as well, too, as a physician there, and learned a lot over the years, I have to say, and certainly do support the move towards community supports and services as well. Not that, at least where I was, people got excellent care, but it still wasn't being a part of the regular community, right? Like we all want to be.
Sure.
Yeah. So you worked, you said, both in a state facility and then also in community supports and services. And what would you say are some of the bigger differences?
So obviously there are structural differences that even though I worked with a lot of people that were very passionate and committed, there just were these structural barriers that were hard to overcome. So we were in a kind of, I would say, rural type location, and so there weren't that many opportunities for employment for the people who lived there. And frankly, back at that time, that wasn't really a big priority.
Yeah, it wasn't.
I mean,
certainly.
It was mostly providing just care versus more supports to support the person to do what they wanted to do. It was really more about keeping people healthy and safe.
Yep. And then when you contrast that with community-based supports and services, what are some of the benefits that you see there?
So we work hard to try and assist organizations or support organizations to truly find out what matters to the person receiving support.
That sounds like person-centered services.
Exactly. And then build the supports around them. And so we strongly believe that you have to know what the person's preferred outcome is before you can provide them supports. And so I feel like traditionally there was a menu of supports for the person to choose from, and they were kind of given that option, and that was, the extent of the possibilities. And now I think that it's more tailored to what people want, and then you build the supports around them and what they want.
Yeah, yeah. And so that, I would guess, are some of the things you look for when you're accrediting
Exactly.
bodies, is how person-centered they are in their
Exactly.
provision of supports and services.
Yes. So when we accredit an organization, we have a couple tools that we use. So one is called the basic assurances, and there's really nothing basic about it. It's very extensive, but that's our organizational assessment. And what makes us pretty unique is we look at the organization's, their policies, their systems, but then we take it to the next step and we say, are they putting it into practice? And to do that, we talk to the people receiving services, and we talk to the DSPs, and we talk to the community members. And so we do a variety of activities. We do focus groups. We use a tool called the personal outcome measures, which is
I'm familiar with
You
those.
are?
I am.
So
Yeah.
this tool was developed in the early 90s, and it's really a discovery tool to find out what's important to the person receiving supports. And so you go through all of the outcomes and you have them define it. So for example, if you're talking about health, my definition of health may be different from your definition
That's
of
very
health.
true.
So my definition of health is I would love to sleep through the night just once, right?
Right.
Not have those wheels spinning. Somebody else may want to reduce the number of medications they're on. So you have to find out how the person defines health before you can support them to have their best possible health. And that's just one of the tools that we use to find out, are those systems in practice at the organizational level.
Going back to personal outcome measures, one of the things that I found really fascinating, and I actually use this in some of the talks that I do related to social determinants of health, some of the information that CQL has put out related to social determinants of health, in particular, the reduction in injuries, the reduction in emergency room visits, the reduction in
behavioral incidents.
Yes, quote, behavioral incidents that relate to the way a person is supported.
Yes.
Simple things. Can you elaborate on a couple of those?
Yes. So a lot of the research that we have done in terms of social determinants of health, it isn't very surprising. I mean, we've kind of known it in our gut. But our director of research, Dr. Carly Friedman, she's been able to do analysis that shows that if you do X, then you may see Y. And so we found correlations between how you treat your staff. And
that was one of the more fascinating things to me.
And it makes sense, right?
Yeah, if you treat your staff well, they're going to be happier and they're going to do a better job in their support of people with IDD. Which in turn, this is what blew me away, was the very significant reduction in things like ER visits and difficult behaviors and all of that. And when a person had a choice in their life that made a difference, they were happier. Isn't that amazing?
Yeah, or when you treat people with dignity and respect, which isn't a typical metric that you would use if you're looking at healthcare, for example. You're going to be looking at ER utilization and things of that nature. But we think it's important to look at things like dignity, respect. Are people able to exercise their rights? Do they know what their rights are? So those different non-traditional metrics.
Yeah,
are very interesting.
Well, I encourage you to look those up if you haven't seen them before. You can find them on CQL's website. I think it's SDOH. I don't remember exactly how to get there, but
if you go to our website, you'll find all of that research, and the personal outcome measures manual is actually available on our website. You can download that for free if you're interested. We have a lot of free training that can benefit a lot of people, a lot of webinars. We try and promote sharing information and knowledge.
So, Mary Kay, you are the CEO of CQL. What are some of your responsibilities?
So I have an amazing group of staff that I work with that kind of lead our efforts in terms of our accreditation work and our certification and training work, our research. And I try and promote the good work that they do. I try and empower the staff to be able to do the work that they're doing that ultimately improves people in the support system, their quality of life, and the organizations improve the quality of services that they provide. And so, you have all of the administrative stuff.
Yeah.
I work closely with our board of directors. We have just a top-notch board of directors.
Excellent.
Including Maggie from AAIDD. We are at AAIDD.
Thank you for
right
bringing
now.
that up. We are at the AAIDD conference,
Yes,
American Association on Intellectual and Developmental Disabilities
Yes.
conference in Pittsburgh.
Yes, and Margaret Nygren is
Yep.
the executive director,
Yep.
and she's on our board. So,
Yep, we're going to get her in here soon.
yes,
so.
and so we just have fabulous board members that are very supportive of our vision and our mission. And so I work with them, all the operational things in the background. But I really like to also be involved on the ground. And so I play, when they let me, I play an active role in accreditation. I like to go on visits.
That's important, to have your
is.
feet on the ground, even though you're leading an organization, or really because you're leading an organization, it's important to understand all of it and be a part of it.
I enjoy doing that. We speak all over the country on some of the research that we found and the best practices that we have learned from the organizations that we partner with. I like to work with the organizations that we partner with, just keeping up with what they're doing and sharing those best practices. We have different means of getting that information out. We have a capstone, we have multiple research briefs, we do regular webinars just to kind of share the information that we're learning with others.
So a lot of work.
So a lot of fun work.
A lot of fun work. Let me ask you this. What do you think are the most rewarding parts of what you and your organization does?
So one thing that I think is meaningful is accreditation is typically not viewed as a fun activity.
Right.
It's viewed as, some people view it as a survey or an audit. And
Or punitive in some ways.
Exactly. And
Yeah.
we go out of our way to make sure that that is not the experience, that's not the model that we follow. We embrace a model called Appreciative Inquiry, if you've heard of that.
I have not heard of that.
So it's very much a strengths-based model, and so we like to focus on what people are doing well and what organizations are doing well, and then help them to replicate that. And so we don't look at deficits, we look at opportunities and what can we learn from the things that you already are doing well. How can we apply that to other areas of your organization? And so when people view the accreditation process as scary or possibly punitive, it means a lot after when they say, you know what, that was so invigorating and empowering for our staff, and they understand the why, that we are there to help them self-reflect, and we're an external entity that is going to come in and look at their systems in an objective way. And we've also found when you compare when an organization looks at themselves and when we look at them, they do find different things, because if you're working at an organization, you're obviously very invested, you're very close to it. Sometimes it's hard to step back and see things from, a different perspective. And so I think we bring that. And so it's meaningful when they tell us what a good experience it was, how amazing the staff are. And
it sounds more like a cooperative experience,
Very much.
where
Very much a partnership.
they're learning together and can grow their supports and services through the process.
Exactly.
Or improve them.
Very much. And it's not just a one and done. We don't just go in and do the visit and then leave, and then we talk to you 3 or 4 years later. We have a model where we go in and work with you at mid-cycle type visits, and we also view it as a partnership in that we work with organizations across the entire term. We provide them with resources. We like to connect organizations with other organizations that are doing well. So if they're looking for information on a human rights committee, we like to connect them with 4 or 5 organizations that might have gone through a similar experience.
So you can provide resources and assistance, and that's fantastic.
Yes.
You also have a conference, don't you?
We do.
Yeah.
Yes.
Tell us about that.
We had a wonderful conference last year in Las Vegas, and it was light bulb moments, kind of those aha moments. And we had wonderful speakers. And our conference, I think, is unique in that we ask people to bring resources or strategies that can be replicated so that when attendees come, they take something home with them, something that they can try at their organization. So
that's so important. Sometimes you go to conferences and there's a lot of great information, but it's like, how do I put this into practice? And when I do talks myself, I always try to make sure there are very clear take-home points that people can implement right then, because that's what we come to these for, right?
Right.
Yeah.
And we work with the best organizations in the country, and every organization has something special about them. Every organization brings something to the table. So it's really just a matter of finding that best practice that they're doing so that we can share it with others.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisk.com to learn more about how you can employ these tools with people you support. So Mary Kay, we're coming to the game show part of this.
Uh-oh.
No, it's really simple. Something I call 3 and 3. So you have 3 minutes to tell the audience 3 things that you would like them to know that you think can improve support services, health, wellness, lives of people with intellectual and developmental disabilities. Just general information or advice or some specific tips that you have for listeners out there.
3 things. Wow,
3
this
things.
is tough.
Yeah.
Well, one, I would say embrace a strengths-based approach. That I think it benefits organizations, it benefits people in everything they do in their life. If you look at something and try and find the good, try and find the strengths, and then replicate that, it'll make your services better, it'll make your life better. That's definitely one.
Mm-hmm. That's a good one.
One for services and supports, definitely find out what the preferred outcome is before you start providing supports, because you may be providing supports that aren't necessary, you may be over-supporting people, you may be providing a support that you've just provided for 20 years, so it's just become routine.
You know, that's such a simple thing, but it really is so important. Sometimes we do things because it's always been done that way, and it may not be the best thing or the right thing, so I really like that. That's great advice.
And then maybe I would say to be sure to presume competence and don't be afraid to take risks. And I think that people's lives can benefit greatly from that. I think that that the people that we work with, people who are receiving supports, they need to have those opportunities in life to experience different things and to possibly fail, but to learn.
Risk is involved, right? That's part of life.
And we need to presume competence and not withhold opportunities from people because they have a disability.
Yeah. Well, those are 3 wonderful things to leave the listeners with. Mary Kay, thank you so much for taking the time to join me today. And more importantly, thank you for the amazing work that you do in this field.
Thank you. Thank you for having me.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.